In the next 10 to 15 years, the leading indication for liver transplantation will be non-alcoholic fatty liver disease. Fatty liver disease is a clinical syndrome where excessive fat starts to get deposited within the liver, and that leads to downstream complications. Over time, it creates a stress on the liver where the inflammation starts to kick in, and that's when patients develop progressive liver damage. Fatty infiltration of the liver also leads to insulin resistance, and that leads to glucose intolerance, i.e. diabetes. And when the liver develops cirrhosis, the whole body starts to dysfunction, and patients who have liver failure will develop kidney problems, circulation issues, heart problems, lung problems, problems with nitrogenous products which will not get detoxified in the liver, go to the brain and cause confusion and even put patients into coma. Luckily, majority of these patients have what we call simple steatosis, where the liver disease does not progress and does not impact the quality of life or the life expectancy. Now, a small proportion of the patients, anywhere from 10 to 25%, can develop non-alcoholic steatohepatitis where there's inflammation, fibrosis, or scarring in the liver cells in response to the fat accumulation. And that is progressive. Most important things that one can do to prevent the development of liver disease is to eat healthy and maintain their weight, so have a BMI of less than 25. How are you going to achieve that? Diet and exercise. What causes a patient to develop fatty liver? It's multifactorial. There is genetics involved. There are other theories and environmental issues. Right now, the best test to really diagnose fatty liver disease is a liver biopsy. There are some other non-invasive tests, but they're costly. So obviously, we don't recommend 100 million patients who are suspected to have fatty liver to get a liver biopsy. Patients who are heavy, who have diabetes, hypertension, hyperlipidemia, they are highly likely to have the progressive form of the liver disease. So those patients we will biopsy. Most of the patients that come into our practice, we'll follow them for a couple of years. We will use non-invasive measures where we'll ask them to lose weight, aggressively control their hyperlipidemia, diabetes, and hypertension. And if they are unable to, then we will get a liver biopsy to see where they are. And we're hoping that in the next year or so, we will start to categorize these patients based on non-invasive testing.